Right now, I alternate between rotations between Duke, the VA, and here at UNC Chapel Hill. When I'm not there, though, I work in the Center for AIDS Research, Virology, Immunology, and Microbiology Core lab. Currently, I am on a committee that is promoting diversity and inclusion within occupational therapy and specifically within our program.
Last semester I had 5 classes, this semester I have 4 classes, and on top of that I'm working on my master's research paper.
So right now, I'm a first year, so we're in our second semester of classes. So along with that, I do SHAC Triage, which is the Student Health Action Coalition. I also coach functional fitness part-time at O2 Fitness in Carborough.
Right now we are doing our final clinical rotation, and I'm at Duke Regional Hospital, and so I'm there full-time every day, Monday through Friday, and I have 2 night classes that I'm taking right now, voice disorders and counseling.
I have clinical rotations Tuesday through Thursday at the Wake Med Heart Center. I'm also a resident advisor on my campus, so I have 58 assigned residents. And I also have classes Mondays and Fridays.
As a first-year PT student, I'm basically in class from 8 to 4 most days, and I also work, and I'm basically studying.
I'm thinking of working for around 2 years, hopefully in a research lab around the area or going back up to Boston. And then I'll hopefully apply to med school and see where that takes me after that. I would ideally like to end up in inpatient rehab. I really like that I get to spend a little bit more time with the patients and build a relationship.
After I'm licensed, I'm hoping that I can work in a private practice setting with children with developmental disabilities.
So I'm really interested in applying to residency after I graduate from PT school.
In the future, I would like to work in adult acute care in a hospital, so I'm in the process of applying to hospitals that have open positions. Specifically in North Carolina, I would like to stay around here.
I'll work at the cath lab for about a year or 2 and then hopefully go to med school. I want to be a physician in the future so that I can work in international health.
Maybe pursue a residency in geriatric PT. I see that big need and kind of the neglect of the geriatric population within the healthcare system.
Being a student out of state, trying to balance my work life, working clinical rotations, but then also trying to work to pay for my education is a lot. So having the support of the association means the world to me. It's meant a lot to be able to take part of that financial burden off of me and allow me to focus on getting my education and setting that foundation that I need for occupational therapy.
I've used it towards my living expenses, so that's definitely helped. Being out of state and having that extra help right away was amazing.
By having the scholarship, it's actually significantly cut down on the hours that I need to work part-time to be able to pay for PT school.
This fellowship's meant a lot to me. I was getting kind of overwhelmed with the amount of student loans that were accumulating, and this has really allowed me to focus more on my schoolwork and my clinicals. So this has really helped me tremendously, and I'm very appreciative of it.
I think the scholarship really solidified the idea to me that there are people out there who really value my education, and it also helped me a lot financially throughout the semester so that I could focus on my studies instead of figuring out how can I pay for things and how can I afford to do certain things throughout the semester.
The scholarship has kind of alleviated some of the burden and the stresses that the tuition kind of piles on, so it's kind of alleviated that so I can fully focus on my studies.
The medical school itself, the Allied Health Sciences program within the medical school as well, connected to the hospital. I saw that when I was applying and looking at schools, and I saw that connection as something that offered a lot of potential, and just fell in love and just felt right that I had found my niche. They don't just look at a person as their condition or like the health problem itself. They try to look at the other social determinants of health, the other factors that are within an individual's lives.
The opportunities that UNC gives you with internship and practicum and the hours that you can actually get hands-on experience, all that stuff together has made me realize that it was definitely the right choice.
I really was drawn to UNC because we learn the theory behind everything versus what exercises just to give someone. So we learn about why we're giving those exercises.
I was able to be a part of the speech and hearing sciences minor and learn from the professors, and I just feel like it was an incredible program. It's one of the top in the country.
I really like our program director and all the professors that I had. They're very friendly, they're very knowledgeable in their field, and they're also very invested in my education.
Carolina feels like home to me. I met the faculty here and the students, and they were like more welcoming than any program I had kind of like shadowed in or took tours at, and I love UNC.
It's harder and harder to recruit other clinical laboratory sciences that are truly studied it for its passion. So that's a huge motivation for me to keep going forward as somebody that has studied this, loves it, and wants to recruit other people in the field.
My mother worked 3 part-time jobs while I was growing up. I think of her unwavering example of what it meant to be a hardworking individual, and that's what keeps me motivated.
Motivating is the money aspect, but also motivating is the fact that I want to benefit my community and give something back.
I'm really motivated to do well as a student because I think in physical therapy specifically that it is a unique niche that moving forward I think people can be able to take more advantage of.
The patients are what motivates me. Seeing them every day, getting to know them or to help them accomplish a goal, it really means a lot.
What motivates me is the fact that I know that what I do will matter in the future, and it still matters now. As a healthcare provider, you're able to say that your health situation matters to me, and I know what I can do to improve your situation, and I think that's very meaningful.
My patient's health will kind of be in my hands, so that's a big kind of responsibility to carry, and so that's one of my biggest motivations to become the best PT I can right now.